What's up, guys? Welcome to a mobility class for internal rotation of the shoulder. So if we're going to go over that range of motion quick, internal rotation is this way, external rotation is this way. So internal rotation is really commonly lacking in the throwing athlete or any type of overhead athlete, but it's also going to be lacking in a lot of people just in general. It's going to be the first range of motion that we lose in a degenerative shoulder. So someone who's undergoing some arthritis or some type of pathology in the shoulder, almost always the first range of motion they lose is internal rotation. So that one we have to really work at to keep. The first thing we're going to do here is we're just going to start by hitting some of the tissues on the back side of the shoulder that will limit internal rotation. So these are specifically some of your rotator cuff muscles, your infraspinatus and your teres minor. You're going to place the ball right here, okay? So you have your shoulder blade back here, and then you have these muscles that sit under this little bump here. Those are the muscles that we're going to target here, and we're going to get to that position from the sleeper stretch. So ball is going to go under, you're going to roll forward, kind of pivot around here, and you're going to find those tender trigger point areas. If it's producing any numbness or anything like that, that's actually really normal from this area. Now, if you're like way under here in your armpit, that's not what we want. That numbness is different. But if we're out here, all we want to do is now go into internal rotation as we're kind of pinning that trigger point, and then external rotation. Internal rotation and external rotation. Internal, external. And at these end ranges, let's try to just squeeze as much range as we possibly can. And now you're going to adjust, and you're going to find a new trigger point or a new tender area. You're going to kind of try to pin that with the ball, and then you're going to move into internal and external. This is a really common trigger point. So once you've worked through a few of those trigger points, we're going to switch to the other side, and we're going to do the exact same thing this time. I'll maybe show you from the back side here. So you're just going to roll this, and you're going to put that ball right on the back side of the shoulder. Roll on to those rotator cuff muscles, and you're going to go internal, external. Nice, slow, and controlled. If the lacrosse ball that I'm using is too much, then just grab a tennis ball or something a little softer. Trying to squeeze as much range as we can on each of these. And what you'll probably notice is that you have quite a bit of variation from the right to the left shoulder. Most commonly, your right shoulder is going to lack internal rotation, although that doesn't happen all the time. As I've seen over many years of treating patients in the clinic, that you can also lack it on the left side too. Okay, so now we're going to go into some GH cars. So we'll just do this at a tall kneeling. So all you're going to do is palm up. You're going to come across with your hand high as you can bring it. You're going to run into a wall here. Once you hit that wall, I want you to think about turning your palm, which is now facing in. I want you to start to rotate that out and squeeze back all the way back. So if you're going to look at it from the side, I'm now in as much extension as I can be in. And then I'm going to come down. And now I'm going to go to the opposite way. Come back as far as I can. I'm going to hit end range extension. I'm going to then rotate. So my hand is now coming to face towards my ear, or my palm is, I should say. And then I'm going to squeeze back down. So no part of this is like super passive. I'm trying to squeeze as much range out of this circle of my shoulder as I possibly can. Rep number 2. And I love the visual in my brain of thinking about, this is my total workspace that I have with my shoulder, is what's called CARs, right? Controlled articular rotations. So I'm trying to carve as much space out of this range as I can to teach my brain that all of that range is okay to use. Okay, so if someone is, trying to catch a barbell overhead or throw a baseball really fast, and they want to use that shoulder for that, they need as much workspace as possible to be able to train in. Okay, so 3 there. We're going to go left side, palm faces up, cross midline. So if you're going to look at what that looks like here, palm up, cross midline. Come as high as you can. You're going to brush your bicep by your ear. You're going to rotate around and back. And you're going to come here, back, rotate around. Rep 2. Squeezing as much as you can. I'll show you this one from the side. Come back. So that's my end range extension. I'm not letting my shoulder blade dip too far forward, or I'm not moving my trunk. Just moving in my shoulder. And just letting my bicep brush by my ear. One more rep. All right, so those are our cars. Cars are an amazing, again, way to look at your total workspace. They are good for, I'm gonna go grab a yoga block. They're good for not just the brain, like I said, because we have what are called mental maps of movement at each individual joint. And the better you are at owning all of the ranges afforded to each of your joints, the better off you're going to be overall in movement and in life, because the more information, which is afferents, we're going to get from our joint system up to our brain, the better the patterns are that we can put back down into the real world, okay? So let's go into internal rotation. This is going to be your stretch. So with this, I want you to tuck your shoulder blade back and down. So I'm bringing my shoulder away from my ear. I don't want to be super sloppy here and just, this is my stretch. I want to be actually forcing the movement to happen just at this joint here. So tuck the shoulder back and down, and then I'm going to stretch, and I'm going to hit my end range. Now, if you're doing this on your own and you have the time, I want you to accumulate 2 minutes of stretch time here. That is going to help to actually change the tissue. And that's kind of the minimum threshold that you need for like long-term tissue change is 2 minutes of stretching time or time under tension at end range. Now we're going to go into our pails, which is an isometric. So we're going to push up. Our right hand is going to push this way into the left hand, and the left hand is going to resist that pressure. We're going to start with 25% of our maximum contraction. And you're just going to hold that tension on there. I'm going to ramp it up to 50%. 75. And your greatest, safest, pain-free effort. Hold, hold, hold for 5, 4, 3, 2, 1. Now we're going to go the opposite way. You're not going to be able to move here, but I want you to think about driving this down as hard as you possibly can. Hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And relax, getting deeper into internal rotation. So you're going to notice now you have more range here. You shouldn't get like a pinch in your shoulder, although this is going to feel like a deeper stretch than you're used to. If you're getting a pinch, you might have to open your chest up a little bit, and that'll actually free up this space here. If you're fine though, I want you to roll into that, and then you get like it just becomes more of like it forces the movement to happen here, versus if I'm open, you're more likely to anteriorly tilt the shoulder blade. But if you're getting a pinch, open it up and just do your best to keep that scap stable. We're going to go one more set of pails rails here. So we're going to start pushing back 25%. 50, 75, and 100% your greatest, safest pain-free effort. Hold. 5, 4, 3, 2, 1, and relax. Come on, right into rails. Fight for it. Try to bring this down to the ground. Hold for 5, 4. It's just a long 5 seconds when I do it instead of 10. 3, 2, 1, and relax. Okay, now we're going to flip over and we're going to do the left side here. All right, so same thing into internal rotation. Again, if you have a lot of restriction here, feel free to accumulate some more time stretching. You can, well, maybe don't be on your phone. We're on our phones enough, but you can do whatever when you're stretching. Just kind of hang out, explore those end ranges, think about your day. All right, so now we're going to go pails, pushing up 25%. Ramped up to 50. 75. And 100%, hard as you can push. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Automatically into rails, trying to drive your fist down to the ground. Hold, hold, hold for 5, 4, 3, 2, 1. And relax. Just hold that position. Accumulate a little time under tension, and we'll go right into pails again. We're going to push up 25%, 50, 75, and your greatest, safest pain-free effort. Push, push, push. I'm pushing up with my left arm right now. 5, 4, 3, 2, 1. Right into rails. Driving this down. Hold for 5, 4, 3, 2, 1. And relax. Okay, so now we're going to just pop right into, so I just want to explain quick what the goal of that is. So pails rails is we're taking the joint to end range and then we're doing isometrics both in the progressive and the regressive tissue. So we're training kind of, it's the safest and best way to train that tissue. Now, if you've been doing pails rails for a while, say you're a patient of mine, or you've been doing some FRC, feel free to like add more intensity. That's how you get, if you've hit a wall with your mobility and you're like, I just can't seem to get over the hump, you got to add more intensity. So either bring more to the table or hold it longer or do more sets. You're going to have to increase one of those to try to still get more adaptation, okay? So if you're really trying to like, you know, hammer this end range tissue, like, and you need it for whatever you're trying to do, you may need to increase the volume of which you're doing that with. But 2 sets, I can tell you right now, like, I feel really good there. So what we're going to do is swimmers to finish here. Okay, so swimmers is basically, I'll show you from the side first, is just a way that we're going to do, it's a semi version of cars. So we're going to start an internal rotation with extension. So if I were to show you from the back side, actually that might be the best. These are trying to almost touch each other as we're holding our torso stable. Then we're going to come down, we're going to rotate up and around, and then we're going to come up and they're going to come up top. So we're kind of just fighting for as much range as we can. If we were to look at it from the side, at no time during swimmers am I allowing any of my arm to come past kind of my midline. So if I had a sheet of glass here that was cutting through the middle of my body, that's not going to allow any of my arm to come past that sheet of glass. So if I went like this, it would go, There's no way you're allowing that arm to come past, and we're staying in what's called the frontal plane, and we're not allowing us to come into the sagittal plane. Okay, so we're going to do it prone. I'm going to use a yoga block here to just rest my head on. If you don't have that, you can use a pillow or whatever. Okay, so we're just going to do a couple sets of this first. We're going to start here in internal. We're going to brace. We're going to bring our hands off of our back, and then you can just follow me, okay? So create some stability, irradiate, bring this up. We're going to extend, rotate around, and these come together. So there's one. We're going to do 15 of these. 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9. All right. When you're getting fatigued, just make sure you're keeping your hands behind midline. 9, 9, 10, 10. Whew. I got a little aggressive with 15. 11, 11, 12, 12, 13, 13, 14. And 15. Whew. Okay, so again, if you're wanting to add volume, do more sets than that. But that is our internal rotation mobility class for the shoulder. Again, it's a great one to do. If you're really trying to change this tissue, at least do this class a couple times a week. Doing your cars every day and pails, rails, you can do those at least 3 or 4 times a week. But if you're going to include a full class like this, I would do it at least twice a week. So